Seizures used to be called fits, and it was awful.
In the back of my mind, I can remember somebody saying, putting a spoon on the person's tongue.
The idea of possession or demonic influences. Something takes over the body, takes over the mind.
Panic. You will think you know the right thing to do.
It scares you to death to see your child totally out of control, unconscious.
Is that what it was? Oh, we thought she was mentally disturbed.
Insurance companies refuse to pick you up. They think, that you're going to drop
Is
dead
when
and
their
cost them
reactions are, oh, the poor thing, or, oh, I feel so sorry for her.
You have a million questions, Why is this happening?
My biggest fear when I started having seizures was that I would lose control of my life.
Marion Clignet had her first seizure when she was 21. That meant she had to learn to live with regular medication and without a driver's license.
Because of epilepsy, I started to ride my bike because I needed transportation. I lost my driver's license for a year, and one thing led to another. First, I used it as transportation, and then I started getting into racing. So it really inspired me. And I think also because of the epilepsy, I was motivated to work harder and show people that, hey, this is no big deal, so get out of my hair with it.
In just a few years, Marion has reached the front ranks of competitive cycling. Now she is headed for the Olympics. But first, Marion learned to live with a condition whose cause is often unknown and whose course is unpredictable. And that makes friends especially important.
One friend in particular really helped me in dealing with the epilepsy by telling me that, it could be one of two ways. Either the epilepsy controlled me or I controlled it.
But even close friends can be surprised by the loss of control that comes with a seizure.
She had a seizure one time that I saw. It was here at the club. I was here in the morning working out, and she was just finishing up, and I was talking to her, and I heard a noise, and I looked over, and she was on the ground. I'd never seen anything like it before. She's laying there, and her body's got spasms, and her face, her eyes started rolling back in her head, and she started breathing real heavy, and it was just, it was really weird. It was scary to see it, and I had no idea what to do.
When someone has a convulsive seizure, each of us should know what to do. First, stay calm. The person is unconscious and is not feeling any pain. Make sure they won't hurt themselves by bumping into sharp objects. Loosen tight clothing. Don't try to restrain them or force anything into their mouth. It is impossible to swallow the tongue. Tell onlookers it is a seizure and that it will be over soon. If the seizure lasts more than 5 minutes, or if the person is injured or pregnant, call the ambulance. As the seizure subsides, roll them to their side so they can breathe freely. It is important to observe and remember the sequence of events. This information is essential to the physician. As the seizure goes away, be calm, supportive, and reassuring.
Help me. Yeah.
I thought it was kind of neat that he could, watch me lose complete control of myself, not that I don't at other times anyway, and then, still be the same friend, just not have any different thoughts towards me, after seeing what I went through. And there's no reason why he should, and I knew that in my head, but then to see it really happen was special. One more. Come on.
I guess the main thing people should understand about epilepsy is you don't have to treat someone like they're a criminal or something. It's something that, it just is, and there's no problem really once you get the drugs, and it just, they're just a person, same as anyone else.
And all the blood goes to your head. It's really good for you.
Like Marion, Gerard Jackson has complete seizure control, but that took time. The Jackson family learned that sometimes epilepsy can go unnoticed.
It took a while for me to find out that Gerard was having seizures. I first noticed that he did quite a bit of staring, and I kind of looked at it as just daydreaming. I really did. I thought Gerard was just daydreaming. At the time, he had a teacher who was very observant. So she said, by the way, I have noticed that Gerard is staring quite a bit. And then on one occasion, she noticed that he had gone to the pencil sharpener, and instead of just sharpening his pencil, he stayed there. She saw him hesitate.
When I have a seizure, my eyes go up in my head a little, and I like shiver or shake, and I go off to the side.
After that would take place, it would be over. You know, we would say, Gerard. And he would say, Dad, I just had another seizure.
I guess it's like being unaware of what you're doing. You're not controlling yourself. You're just blank.
When Gerard goes blank, he's having a seizure. A seizure is an abnormal discharge of nerve cells in the brain. Some people have likened it to an electrical storm in the brain. There are three main ways that seizures show up. The first way is a convulsion. This is the kind of seizure that most people recognize. It's been called a generalized tonic-clonic seizure or a grand mal seizure. During a convulsion, the patient gets stiff, then has jerking movements, and then goes limp. During the time the patient's limp, they may lose control of their bowel or bladder. And following that period of time, patients are often sleepy and confused. Staring seizures may be a symptom of either an absent seizure or a partial complex seizure. During a partial complex seizure, patients may appear dazed or confused. They may fumble with their clothes. They may walk around aimlessly. Very brief staring seizures are absent seizures. In all three kinds of seizures, consciousness is impaired or lost. Seizures may be caused by many things, for example, a head injury or a chemical imbalance, but in more than half of patients, the cause of seizures is unknown. In some patients, seizures can be cured. In other patients, they can be controlled by medication. But in any event, the key to the good management of the patient is to assemble a good team. The team includes teachers, coaches, babysitters, and other relatives. And as the Jacksons found out, the first step is to find the right physician.
Sometimes with doctors, you come across humbly because you don't have the information. You are seeking, you're searching. But sometimes you reach a level of, I would say, just being angry. You know, I need to be educated. Don't expect me to know anything. It's my child. I'm the parent. I can ask you anything I want to. You know, just don't keep anything from me.
Good. Why don't you have a seat up here?
For this neurologist, the doctor's role is clear.
The most important issue would be that he has to develop a trust. He has to explain every inch of the way. He has to explain what the epilepsy entails, the ins and outs, the difficulties that will be confronted, the prognosis, the medications needed, what those medications have insofar as side effects. He has to give them the best and the worst scenarios, prepare them. In other words, give them the whole picture.
He listened, and that's a good thing. He listened to me. I just didn't have to listen to him. He listened to me.
See, he's growing.
And together, their goal is to make treatment an uneventful part of Gerard's life, one that he can handle himself.
I don't want Gerard to think that he's a burden, that our whole lifestyle has to change totally because of him. And I want him to feel that he's a responsible person, and he is. I don't tie his shoes anymore. He ties his own shoes. So this is a part of his growing up.
But seizures and medication are only one piece of Gerard's life.
People suffer more from the social effects of epilepsy than they do from the seizures themselves. The seizures are no problem to deal with. You know, it's the social implications that a lot of people have trouble with.
Everything looks pretty good.
When I first had seizures, I had a hard time in class because the children made fun of me. They treated me like I was unnormal to the whole class, Like, I wasn't like them, since I had a problem that none of them had.
Gerard, he plays a lot, so they thought that he was just playing. You know, he would shake, and so they just thought that he was playing, and they would laugh. So they didn't know what it was. If they knew that, they wouldn't do that.
My wife talked with the students and explained to them what was taking place, and explained to them that this was not a laughing matter.
Rather than hide Gerard's epilepsy, the Jacksons chose to educate the people around them.
My openness has gained for me more knowledge. That's the key to educating my family. That's the key to making them more comfortable. That's the key to giving Gerard a fair chance in life. He should not be made to feel that he is so different that he can't fit into this society, even as a young person.
This is 9. Where's home? I did 5. Great.
Sometimes seizures cannot be controlled, as the Lindgren family found out.
The first seizure happened when she was asleep and I was home alone. And I went in and I found her on her side, stiff and blue. And my immediate reaction was that she had died. Then I realized she was breathing.
Hop on one foot, please.
One of our friends who Leslie called had mentioned that they were at the local hospital and that Jessica had had a seizure. And I thought, my God, a seizure. It was like somebody sticking you with a knife.
We were expecting our lives to return to normal, and our lives have not returned to normal.
The Lindgren's daughter Jessica is now 7. Her seizures started when she was 8 months old. For about 15% of people with epilepsy, complete seizure control is still just a hope.
As many drugs as possible for her have been tried, and nothing has worked. She has had fewer seizures, but she has not had complete seizure control while she's been on the medication. And that has been very, very, very frustrating for us.
With or without seizures, every child needs to share the growing up experience of going to school with other children.
If we have a child who may be on medication but whose seizures are not fully under control, I feel that's not a heavy problem for anyone as long as we have the education, the knowledge of what to do in any given situation.
32.
Read it the other way. This one first.
If we have that knowledge, then once we've been involved with the children and we've had the experience, it's just like anything else in life. Once you've had the experience, it's not a big deal. It's not anything that's exceptional. It's just part of this child's life in your school.
That's an equal sign. We need a plus.
Plus?
When I look at Jessica, I do not think of her as an epileptic child. I think of her as a whole child who has her own special needs for education, and we try to meet those needs. Because 2 and 1 is how many altogether? Say it in your voice.
3.
Write a 3 up there.
Jessica gets some individual help, but most of the day she spends with teacher Millie Patstone and her regular first-grade class.
I think it's important that the other children realize that just because she does have epilepsy, that she needs to be in the classroom also. I mean, it's not something that she should be put in another room. If someone had a broken leg, you wouldn't want that child put in another room for that amount of time. She's a kiddo, first of all, before she's anything else. And I think it's real important that she and other children see that.
Okay, look at.
Once children and teachers get to know someone who has epilepsy and learn what it is and how to respond to a seizure, layers of fear and superstition fall away and ordinary life goes on. That means Jessica has a chance to learn and grow without feeling isolated and apart.
For Jessica to be independent, I think she really needs to know that she's one of the kiddos, and I want to say guys, she's one of the guys, and she's going to be treated like one of the guys.
When I call your table, you need to get your things. She's going to begin going to the bathroom by herself. I'm going to send her on errands to the office, send her to get her own juice at snack time. There is always a risk. She could have a seizure, and she might be alone, but you know, someone is always fairly close by. And I think that's just a risk we have to take.
And the more the people around Jessica know about seizures, the less risk for her. If you don't know what it is, a seizure can be a startling event.
Okay, Jess. This is the aftershocks that she will have sometimes.
I envy those people that, I guess, can control their seizure disorder with the medication. Unfortunately for us, that has not been the case. And in essence, it's been a trial and error situation, and it's a very delicate balance. Sometimes this medication works, and other times it doesn't, but it seems that there are no easy answers.
Well, I like to visit the moon on a rocket ship high in the air. I like to visit the moon, but I don't think I'd like to live there.
Amanda is seizure-free. Still, she found it's better if people know she has epilepsy.
When I found out I had epilepsy, I was kind of confused. I kept my seizure a secret as much as I could when I was younger. I knew my friends would, sometimes tease people that were different, and I guess I was just scared.
I was really very overprotective until recently, and I've learned that it's her illness to deal with, and I think the neurologist was really right when he said she could have a seizure almost anywhere. She could have it driving a car, she could have it swimming, she could have it crossing the street, and if I worry or she worries about it, she's going to have to stay in a little room by herself the rest of her life.
Unfortunately, many people are still confused about epilepsy. Finding a job or getting health insurance or just being accepted can be a frustrating experience. Even when epilepsy is controlled, how to talk about it is a dilemma that each family has to face.
I think my biggest fear about disclosing her condition to teachers, coaches, friends, was that others would treat her differently, or that they would declare her ineligible for certain activities.
Image, the positive self-image. We may be a person who develops. Many students were asking questions, which said, what is it? What do you do? Do you thrash around on the floor? Do you salivate? What do you do? So right away, I knew that the myths were right there in the classroom.
I used to thought of people like foaming at the mouth, and someone had to go and put a stick to keep them from swallowing their tongue.
I didn't know that there was medicine that could control the effects of it, and
It surprised me telling my class that they didn't know anything, but it also surprised me that they really wanted to know. I think that it's a secret that should be told to everyone because it is a burden, and it is something I feel like I'm keeping from everyone else when I really shouldn't.
Show me your left shoulder. You may do this with a kick. Show me your left shoulder. I want to see your left shoulder and your left hip out of the water. Okay? Keep your kick going.
Seizure disorders present little more problems to us than children that have asthma, children that have Tourette's syndrome, children that may have severe allergies. We have children that come with flus. There are many types of things. It simply is one of the things that we simply have to know. But it's not a problem. It does not have to be a problem.
You can do it.
For Amanda and for Gerard and Marion, Advances in medicine have made it possible to lead seizure-free lives. A seizure is only a few moments out of a person's life. Each of us needs to know what to do in those few moments. The rest of the time, they are just like you and me.
I want my friends to treat me like I'm as normal as they are. There's no problem with me. It's just I have seizures, that's all.
Thank you.